And we are back. Medicare decisions can be quite complex, but there's no need for them to be overwhelming. Making the wrong choice can result in lifetime penalties, inadequate coverage, and subpar health care. Today, we're joined by a Medicare expert from Chapter and the author of the book, It's Not That Complicated. Ari Parker joins us now discussing the annual enrollment period and some costly common mistakes that people often make. And Ari, good to have you with us.
Thank you so much for
Ari,
having
do we
me.
have you? I think we've got some technical difficulties. Ari, can I hear you?
Yes,
Oh,
I'm
okay,
here.
sorry. Thank you. All right, just want to make sure we got through the technical difficulties. And when we talk about, Medicare, Medicaid, really some common mistakes that we talked about in the lead. What are some of those costly mistakes that people are making?
Yeah, there's a lot of costly mistakes that people make, and the time to review these mistakes and fix them is happening right now during the Medicare open enrollment period, which ends December 7th. So, what are some of the mistakes that we see? The first is not reviewing your coverage. Medicare plans change every year. So can your health. So, it's important to review what plan is right for you. And you can't find this out based on television. Joe Namath doesn't know what doctors you see. He doesn't know what medications you take, and he doesn't know what's important to you. So it's important to choose what plan is right based on your three Ps. And your three Ps are your providers, who are the doctors you see, your prescriptions, what medications do you take? Are they brand name or are they generic? And what pharmacy do you like to go to? And then finally, it's based on your priorities. What's important to you? Do you travel out of state? Do you perhaps plan to go on vacation somewhere else? It's important to review your three Ps to prepare for the Medicare open enrollment period.
As we talk about Medicare open enrollment, people don't always think about this thing called maximizing my benefits, right? They just pretty much sometimes just go with the flow. They're presented with something, they take something, they go with it. What are the things I can do if I want to maximize, if I want to also save some money on this? Because everybody's looking to save money, particularly at a time like this.
Absolutely. And many of our viewers, as you mentioned, have Medicare and Medicaid. If you have Medicare and Medicaid, then it's important to review your coverage to make sure that you're getting important benefits that might be available to you. Because those benefits are going to vary, whether you need transportation to dialysis, for example, or whether you want a flex card or a grocery card or something else, maybe even a gym membership. All of those will be important to review in anticipation of the Medicare open enrollment period. And you need to act before December 7th in order to find the plan that's right for you.
Yeah. So people do have some time. December the 7th is right around the corner. Not a lot of time, but they can go ahead and enroll and find out what they need to do in order to be right for the upcoming year. When we talk about 2024, a lot to look forward to in the world of health. One of the things we're talking about is the rise in prescription costs. How is this going to impact the average person with the rise in prescription drug costs?
It's a great question. For the very first time ever, there's going to be a maximum out-of-pocket cap on Medicare Part D. D is in drugs. Previously, there'd been no maximum. So some seniors were paying thousands of dollars for expensive prescriptions, up to $15,000 per year. That won't be the case starting in January. Beginning next year, there's going to be a maximum out-of-pocket cap, and it's going to roughly amount to $3,300 for the upcoming year. So if you're on expensive prescriptions, all the more reason to review your coverage before December 7th.
Yeah. Well, when it talks about annual plans, I know that sometimes people look at it and say, this is just like a Cheesecake Factory menu. I mean, it's a whole lot to have to wade through. When you look at it, somebody says, this, that. But what should people really be paying attention to when they're looking? Because it's a lot of fine prints, a lot of stuff they have to wade through. But if you give us a glossary glance, is what people should be paying attention to.
Yeah, you're absolutely right. These plans can look like a cheesecake menu, but it's not that complicated. In my short book on Medicare, which takes less than 2 hours to read, you can find it on Amazon. It's a bestseller. I go through our three Ps method. Your three Ps are first, your providers. What doctors do you see? We need to make sure that they're all in network. The second P are your prescriptions. What medications do you take, brand name or generic? The final P are your priorities. What's important to you? We have all of this at the touch of our fingertips and can sort through your 3Ps to find you the single best fitting plan for you. So it's not like the Cheesecake Factory menu.
Not like the Cheesecake Factory menu. Well, talk to me about the book. Obviously, you are the author of the book. It's not that complicated, but for so many people, it is complicated. And you kind of like simplify things for people.
Yeah, that was the goal. It was based on my parents' experience with Medicare. They had an awful time. And I just wanted to provide a resource for people in order to help them choose the right plan for you. So whether you're a viewer and maybe you're an adult child who's helping your parents, I think you can really find value in the book, and it's a short read. You can also visit our website, askchapter.org, or you can call us toll free at 888-487-2023. And there's no charge to work with me and my team.
Share with me a little bit more because I do want our viewers to become more aware of the Medicare Part A late enrollment penalty that's out there. What do they need to know there?
Yeah, so there's actually 3 penalties. The first is on Medicare Part A, as you mentioned, and that's if you don't sign up for Medicare timely, then you might have a late enrollment penalty for your hospital costs. You also might have a late enrollment penalty for your medical costs, your Part B. And then finally, there's actually a Part D penalty. D as in drugs. So if you don't sign up in time for Medicare, you actually face 3 penalties. They compound, they keep adding up, and they're a lifetime.
And we find a lot of Americans actually find themselves in a place where they are being penalized. It's simply because sometimes access or really understanding what's in front of them.
Absolutely. It's so important to get educated. And I think a really good way to do that is by checking out the book. It's not that complicated. By visiting the government's website, medicare.gov, or by visiting our website, askchapter.org.
Yeah, and I know that providers are really a challenge for some people. Navigating providers, finding out that maybe your provider isn't providing coverage anymore. That kind of thing can be frustrating. It can be time-consuming. Are there any key questions that you should be asking providers, particularly at a time like right now?
Absolutely. When talking with your doctors, it's important to make sure that they're all in the plan that you want to choose. If they're not in network, you either won't be able to see them or you're going to pay a lot more if they're out of network. So it's really important when talking to your doctors to make sure that they're in network. It's also important to do this for your prescriptions and finally, your priorities and what's important to you, because you want a plan that will be flexible throughout the year and will adjust based on your changing health circumstances.
Yeah. All right, I want to thank you for taking the time to break it down. A lot of information that people need to have in hand and making some decisions before December the 7th. So real crucial time. Glad for you coming to share with us, and hopefully people will take advantage of the information that's presented. And I'm going to let people know if you want more information, visit the website, askchapter.org. Also follow them on Facebook at Chapter Medicare. Encourage you don't go anywhere. We'll be back more open coming up right after this.